नमस्ते। हेलो एवरीवन। मैं हूँ आपका आयुष एनएबीएच गाइड और आज के वीडियो में आपका स्वागत है। आज हम डिस्कस करने वाले हैं इम्पोर्टेंट डॉक्यूमेंट्स इन मेडिकल रिकॉर्ड्स एज पर एनएबीएच गाइडलाइंस। इसके बारे में अलग अलग जगह पे आपके रेफरेंस मिल जाएंगे, जैसे कि एएसी चैप्टर, सीओपी चैप्टर, एमओएम चैप्टर और आईएमएस चैप्टर। Coming to importance of medical records, the patient medical records are very important documents. It helps in effective diagnosis and treatment. Also helps in coordination between different departments by reducing errors, and they play crucial role in legal and insurance matters. So these are the documents where doctor plays a very important role in maintaining these records like OPD case paper, IPD case paper, prescription, discharge sheet or summary. Coming to OPD case paper, all of us know what to write in OPD case paper, but still these are few important points which you have to note, which should be clearly mentioned in the OPD page, like present complaints, history, examination, advice for lab, X-ray or imaging, advice for medicine or admission. These should be must mentioned in OPD. Coming to IPD case papers, like OPD, general information we know, but as per standards, these are few important points you have to keep in mind and you have to prepare documents to note down all these, like general consent, informed consent, initial assessment and reassessment, that should be there. Those points we will not discuss in this, but rest of the points like care plan, pain management or pain assessment, nutritional assessment, discharge summary, these are few important documents of medical record. Related to these we will discuss one by one. Other than these, there are few other events like MLC. In that case, MLC register, informing to police. These are few procedures. In case of foreign patients, Form C is required, which should be filled. In case of referring a patient for investigation or to other hospital, doctor should write clearly all the details. Also, in case of LAMA discharge and in death. So coming to first one, that is consent, it should be bilingual, especially in local language that a person or the patient can understand. So in consent, there are different types of consent like general consent, which should be taken on admission for diagnosis, care, and treatment. Then informed consent, that it educates a patient about the risk, benefit, and alternatives of a given procedure or intervention, therapy, etc. Informed consent in case of vulnerable patients is also important. Consent for HIV testing and LAMA consent. These are important documents. Wherever applicable, they must be included in the medical records. Next is care plan. This is also one of the important document for medical record, in which you have to write diet or pathya, then treatment plan, whatever you have planned, expected outcome of the treatment, alternative treatment available, possible risk in the treatment, expected cost of the treatment, and SNDT. That is, every document you have to sign, name, date, and time. Signature, name, date, and time. So that is SNDT. Next is pain assessment. In general, the standard pain assessment tool is VAS, that is visual analog scale, that has to be followed in all the records or wherever it is applicable. For IPD patients, at least 8 hourly it is done, and after any procedure, especially, it should be done every 4 hourly for the first 24 hours. In few cases like post-op etc., every 15 minutes or hourly it should be done. So this is the visual analog scale by which pain assessment is to be done. Nutritional assessment is also one of the important documents. There are different methods like direct method and indirect methods. In direct methods, it is summarized as ABCD: A for anthropometric methods, B for biochemical and laboratory methods, C for clinical methods, D for dietary evaluation methods, and in indirect methods, ecological, economic, and vital health statistics. Especially anthropometric methods are used where height, weight, head circumference, body mass index, body circumference, skin fold, thickness are measured. In few cases, mixed methods are used for assessment. There are different assessment tools which can be used for nutritional assessment or nutritional screening. These are nutritional risk screenings like NRS, malnutrition universal screening tool, that is MUST, subjective global assessment SGA, screening tool for assessment of malnutrition in pediatrics, that is STAM. So these are proven tools which can be used for nutritional assessment. Next is prescription writing. It is also a document where it's a doctor's responsibility to write it correctly. There are standards which has to be followed, like it should be written on valid prescription pad, clearly mentioning the patient's name, date, and name of medicine, dose, route, frequency, in Ayurvedic medicines Anupana, and duration of medicine also should be mentioned, along with quantity and direction for use and SNDT, signature, name, date, and time. Coming to next, that is verbal orders. In case of verbal orders given to PG students or junior doctors or duty doctors, the one who is authorized to take the verbal orders. And verbal orders are documented by the authorized person or doctor, and SNDT should be done. All verbal orders or telephonically given orders should be countersigned by the doctor in charge or treating doctor within 24 hours. Read back mechanism. In case of verbal orders, the receiver who receives the information and the teller who tells the information. The receiver, after receiving information, should read back to the teller to cross check. Also, the receiver should ask the teller to read the information to cross check. In case if any mistake happens, you have to draw a horizontal line, write error, and do SNDT. So this is in case of verbal orders. So coming to discharge sheet or summary, it is one of the most important documents. It is the summary of patient's record from admission till discharge. So this is the content of discharge summary. The discharge summaries must contain patient name, age, sex, MRD number, address, date of admission, reason for admission, date of discharge, diagnosis, clinical findings and case history, internal medicines administered during the stay, external treatments performed during the stay, investigations done during the stay, discharged medicine, along with all the details as described in prescription, follow up advice, when to take advice, condition of the patient at the time of discharge, instruction about when and how to get urgent care. So this is important point. The urgency should be defined, and uh, it is instruction given to take the care. In case of death, the summary shall include cause of the death. And at the end, it is important that the document should be duly signed. The SNDT practice is very important for doctors to follow throughout all the documents. So this is the discharge summary. Coming to last point, that is, keep watching and don't forget to LSS, like, share and subscribe. Thank you.